Hello, everyone, and welcome to Global Evaluation Week 2022, hosted by the Global Evaluation Initiative and Good Business Lab. Uh, we have a very interesting session lined up for you with representatives from Good Business Lab, United Nations Population Fund, and Shahi Exports. Just to give you an idea of what Good Business Lab is all about, Good Business Lab is a not-for-profit labor innovation organization. Our mission is to lead businesses to improve the lives of all workers. And to give you a macro perspective and the rationale behind the work that we do, uh, the existing rationale is that businesses take care of businesses well. Yes, sort of like a capitalist free market view is that businesses push themselves and each other to achieve the maximum profits, profitability, productivity, and all of that. But while businesses are doing this and trying to improve the world for the better and trying to earn as much profits in the process as well, we find that a lot of workers are neglected while in this process. Today, spending on worker well-being programs is considered mere philanthropy or compliance and not a part of core business strategy. Hence, worker well-being programs are not being scaled up, nor their business potential is being realized. And here is where GBL comes in. At Good Business Lab, we make the business case for investing in worker well-being. We generate and disseminate evidence to prove that investing in worker well-being is good for businesses as well as workers. GBL works across 4 focus areas. Uh, the first one of these is unlocking female labor. So what we find in the geographies that we work in, which is mostly developing countries such as India, a lot of women are locked out of the workforce, and countries such as India suffer from a low female labor participation rate. So we help women engage in decent, respectable, and paid work, as well as we help businesses access this untapped labor pool that they can access as workers for their factories. The second focus area is closing the skill gap. We find that there is a gap between the skills that workers have currently and the skills that people that businesses need in their workforce, as well as the skills that workers need to thrive at their job, right? So we try to plug in this gap by giving soft skills training, by engaging both supervisors and workers in meaningful training to improve their productivity. The third focus area is around improving work environment. We work to provide an amicable and more conducive work environment for manufacturing workforces. A quick example of this is when we worked with a large textile firm and replaced old, light bulbs with new energy efficient LEDs. This helped, the firm conserve their energy costs as well as reduce the temperature on the factory floor, making it more comfortable, building holistic health. So under this area, we safeguard against stressors to health. And just to give you a few quick examples of some projects in this focus area project called Iron Woman, we gave anemic women who needed iron pills, as well as gave them training to increase the uptake of these iron pills. And we gave spectacles to workers who needed them under the eye health project. And now in this slide, I will give you a quick brief of the project life cycle of a typical project here at GBL. So the first stage is the design stage. We go in with a clean slate in a factory to understand how we can help both workers as well as businesses. We understand the problem through qualitative research and co-design the intervention with our partner firm. The second stage is evaluation of the intervention that we've created. So we work to we carry out this methodology called randomized control trials, and we use this to evaluate the impact of the intervention that we've created on both the workers and the business. And now once we have this evidence, so that's where the third stage comes in. We share insights and evidence generated from our experiments on various platforms through a variety of multimedia content. And actually, this webinar itself is a great example of such a dissemination event. And the fourth and the last step is scale up. So we scale up the intervention and the experiment to other settings to challenge and confirm our results. And where applicable, we turn our research and our evidence into products that we take to the market to help businesses improve worker well-being as well as core business outcomes. And from then on, we jump into today's topic, which is how can qualitative research impact business outcome. Just to give you an introduction of what we'll be talking about in today's webinar, Good Business Lab, in collaboration with the United Nations Population Fund, created a return on investment, aka ROI tool, using qualitative and secondary research. This ROI tool helps businesses measure the return on investment on investing in a women's health intervention in a workspace. So as a first step towards building this ROI tool, we carried out a literature review through a systematic study of academic papers. These papers really gave the evidence around what happens when a business invests in a women's health intervention in the workplace, and using the evidence that was already there in sort of like these peer reviewed published papers, we created this return on investment tool. So basically, a business can go in and check what is the return on investment when they decide to do a workplace health intervention. And just to give you an idea of what do I mean by workplace health intervention, it could range from anything from like setting a health clinic in your factory to giving iron pills to anemic women, to giving training around family planning, as well as giving resources around family planning. So all of these really constitute a workplace health intervention. And this ROI tool really gives businesses an idea on what will be the effect on outcomes such as absenteeism, retention, and productivity when they decide to invest in such a ROI tool. Just to give you a brief introduction about our speakers today, we have Sushmita, who's a senior design associate at GBL. She's a co-part of the design team here at GBL, and she really led the design phase and the creation phase of this tool, taking it all the way from like an Excel sheet to an actual web-based tool. We have Federica joining us from UNFPA, who's a sexual and reproductive health data specialist. She is the program manager from UNFPA on this tool. We have Mr. Deepak, who's the general manager, organizational development at Shahi Exports. Shahi Exports is also our industrial partner and the biggest apparel manufacturer in India. We'll be talking about the key insights and challenges from the development phase of the tool. What are the plans to scale up the tool, and how funders play a role in the development of this tool. And we will also have insights from industry on applications of the tool.
Hey everybody, and thank you so much for being here. I'm really excited to be representing the team that worked on this project and to take you through our journey of designing the ROI tool, or ROI as we are now calling it. So in 2019, UNFPA approached GBL to design this web-based return on investment tool that could be used to convince businesses that they should invest in various health interventions for women workers. And they wanted to focus on the sexual and reproductive health of women workers. GBL was interested in doing this project for quite a few reasons. And some of them are here. The first one was that working with UNFPA aligned with our interest in making a business case for investing in worker health, especially women workers' health, which is something that we were already working on. It also gave us the opportunity to take our research and learnings and to apply it in a way that could create a global impact. And true, it was a unique challenge for us to create an entire tool using just literature reviews, but having designed digital tools in-house in the past, such as Inache, which is a worker voice platform, and Pratibha, a supervisor screening tool. This was very much up our alley and something that our research and design teams at GBL were uniquely positioned to work on. I'd also like to add that the design process largely involved qualitative research applied in a very innovative way, which makes Evolve a great platform to talk about this project. This was pretty much the process, but I'll go into the different phases in detail. So as a first step, GBL's team, research team, conducted a systematic literature review, as Rochak was saying, and this included some research papers, and it also included business case studies that helped us understand and quantify the business impact of women's health and productivity in the workplace. We look for business outcomes such as absenteeism, worker turnover, and productivity for each type of intervention. And a total of 7 interventions were shortlisted, and these interventions showed a pattern of improved productivity along with reduced absenteeism and turnover, which in turn brought an ROI, or a return on investment. So here you can sort of see how the interventions were mapped to each of the business outcomes, and you can also see some of the interventions that we focused on for the scope of this project, which included women's health interventions such as when it came to menstrual health, so usage of sanitary napkins, and then also sexual reproductive health training, and peer outreach sessions, life skills training, and also providing sexual reproductive health products at the factory. And these are some interventions that we've already, GBL has been working on with Shahi Exports to explore what the impact is. And this is also something that UNFPA is already working on, which is core to their purpose. So each of these interventions were mapped to business outcomes, and essentially a formula was derived. And this formula could now be used to project what the return on investment would be if a specific company wanted to invest in a specific women's health intervention. And thus the ROI tool was born. And this is a working prototype, but now the next step was to turn this into an approachable and user-friendly web-based tool that businesses would actually want to use. And we had to figure out who the exact users of this tool would be. Would they be somebody in an executive position, or would it be initiated by somebody on the ground who would actually be running these programs? And how would the tool be discovered, considering that it's a web-based tool available on the internet? And would it be used on desktops or phones or tablets? So we took this Google Sheets prototype for a test drive with the various stakeholders that we had identified, and we used qualitative research methodology to interview them on how decisions were made in their factories while they were using the tool, and try to get them to think aloud how the scenario would play out if they were to use this tool in their factories. And these the people that we tested the tool out with are those who work currently or had worked in Shahi Exports organizational development team at various levels. And Mr. Deepak here is one of them. So thanks to Shahi, we were able to test this tool out at a very early stage. We then used the feedback and answers from the interviews to simulate user journeys for different users and create different use case scenarios. And doing this helped us identify what features were required, how the input data should be collected, what data could and could not be collected, because it's rare that we realize that a single person in the organization would have access to all the data at their fingertips. And the other point is that organizations are apprehensive about the information that they put out in a free web-based tool, right? Even if it's hosted on a secure UN server. So challenges came up like how you'd get some numbers as monthly data, some as annual data. Some types of data were not readily available, so they would have to be derived from other data, and our research team was able to work around that. For example, Mr. Deepak was the one who told us that for the textile industry, we should use standard allowed minutes to measure the production target rather than the number of products that were manufactured in a year. And this was new information to us, and we realized that this applied to the textile industry at a global scale. So here I really want to highlight the importance of speaking to your target audience and learning their language. Even in terms of the outputs that this tool could give, different stakeholders wanted different things. And this process helped us design an output solution that could be used at various levels. So whether it was pitching a program to your boss or just comparing two interventions before deciding what to prioritize. We then collaborated with a software developer to turn the design into something that could be visual and clickable. And then we did our second round of user testing. And here we were able to identify the points at which a user might feel stuck, either because there was not enough information on how to proceed, or in some cases, there may have been an information overload. So we got feedback on how to make visuals more relevant and how to present the ROI information in a clear and digestible format. The users were also now able to clearly imagine what they would do with the data next. And this helped us imagine a few new features. Like we decided that we could have a feature where we could bundle a few interventions to give a more holistic ROI, or being able to download reports in different currencies, because sometimes the person funding the intervention may be based in a different place on the globe than where the factory is located. So just having those features that take into consideration what the business needs. So what you see on the screen right now is the third version of the ROI tool, which had an updated interface, which was a lot more intuitive for the user based on the testing session we had done with the previous version. And at this point, it was all about the text and the language and the communication. And we went back and forth on this a lot because it was so integral to the success of the tool. Federica and her team helped us test out this tool with other businesses in Asia Pacific, and they had further insights on how the language and industry terms could be made a lot more universal. And it was also important how the numbers were presented in order to make a compelling case. We had to take some key decisions, such as the decision not to round off numbers and to show like the entire number, even if it was a really large number, and showing whole numbers instead of percentages. That was pretty much our journey of working on ROI, and I'm very much looking forward to see how it can be used to convince companies that investing in worker well-being is good for business. Some learnings that stood out to us. So as the first one was that with any app, an online app, we need to make it easy for the user to feed in data. And kind of have a dialogue with the user, because as humans, we really hate filling out forms. And that is something universal. And we don't want businesses to feel like they have to do something extra and have like an additional burden. So this is sort of a before and an after, where in the first case, we actually expected businesses to fill out like pay grade by lowest salary, medium salary, highest salary. And for a number of reasons, businesses are not going to want to do that. So in our after, our research team was able to actually just use these 3 data points to get all the information that we needed for the algorithm. And then as researchers, there are some data points that we tend to see as sort of back end or rough work, not important to show as the end product, but it's in fact some of these data points that are very important indicators for businesses that the research is working in practice. So, for example, it became very important, as I mentioned earlier, to show the impact on tangible outcomes, such as absenteeism and worker turnover, which can be observed on a factory floor on a day-to-day basis. Initially, our tool was focused only on showing productivity, but with feedback from our business stakeholders, we realized the importance of showing absenteeism and turnover as well, as they are key outcomes. And that became an important thing that we presented in the tool. Another example, which you see here on the screen, is that initially we hadn't shown the hours that had been lost during training of a new worker. And that is something that we had taken into consideration, but then it was important for us to add a note saying that. So that's something that we also incorporated, as you can see on the right. Yeah, the last point was about understanding the nitty-gritties of creating a tool for a global audience. So working with an international organization such as UNFPA gave us that exposure to understand what considerations we needed to incorporate to make the tool more inclusive, even in terms of the language that we used, and to be able to pack in the most detail while keeping it simple enough to understand and then be translated into other languages. So what you see on the screen is a classic example, something that we encountered while designing the tool. What does a mobile clinic look like in your country? If if you're not from this sector and if you don't know what a mobile clinic is, it could be any of these things, right? It could be a clinic on wheels. It could be a clinic on your mobile phone. It could be a person who is a vehicle of mobility transporting a clinic around, like a very portable human doctor. So I think it became very important for us to break that down into its components and then be able to justify the cost of what it takes to have a mobile clinic in that sense, in order to carry out the intervention. Those were the learnings summed up from our journey of working on this tool. And personally, I had an amazing time working with my colleagues in research and design to make this happen. And we all share the sentiment that there's great joy in turning a simple formula into a tool and then having a global audience use it, hoping that it'll be a catalyst for social change on the shop floor. Thank you. And if you're curious to catch a glimpse of how the tool eventually turned out, we have a video for you, post which Federica will talk about UNFPA's role in the tool development.
Dashboard. By clicking Start New Projection, you will be able to begin using the ROI calculator. You will be able to 1. ROI calculations. Each of these programs can be selected individually, or in some cases, you'll see the option to bundle programs together, maximizing the impact of the program's implementation. 2. Start filling in details about your own company or factory. The tool will ask you some baseline information about your factory or company, such as, for example, the number of employees, how many of them are women, and also some baseline data about the rates of absenteeism, turnover, and productivity in your company. You can go back any time to your projection to input these different pieces of baseline information. You will also have the option to download a mega checklist in Excel, where all these fields can be filled in before returning to the ROI tool calculator. In this step of the tool, you'll also be able to select your preferred currency to perform the calculations. Some of the key values will also be presented in US dollars in the final report. This information you provide is securely stored on the website and is used to calculate the impact of the different programs on the business variables and ROI. In the next step, you will be able to review some of the costs related to the provision of these programs in your company. The costs provided by default by the tool can be updated if you have different values or information. After having inputted all the required information in the calculator's fields, the ROI tool will calculate the potential impact of your selected programs on your company's absenteeism, turnover, and productivity. You will also be able to see the estimated ROI of your selected programs based on the savings achieved through the program's implementation versus the costs of service provision. To download the results of your projection, you can click Export Report and save your file on your device. The saved projections will remain available on your personal workspace, and at any time, you can log into your profile to review existing projections or create new ones for comparison. If you have any questions, please refer to the frequently asked questions section of this website. Invest in her. Empower women workers. Boost your business. Start your projection today.
Thank you so much, Sushmita, for the excellent presentation on the ROI tool and all of the research. And I must say, on behalf of UNFPA, really thank you to all the team at GBL who's been involved in this project with us, because it's great to see the tool come to life at the end of all our work. And thanks everyone for listening and joining the webinar today. So before I start the presentation on the ROI tool and really the vision behind the tool, I'll start by introducing myself first and then my organization, the organization I work for. So my name is Federica Maurizio, and I am working at UNFPA as a sexual reproductive health data specialist. And I've been involved in the management of the program that created the ROI tool, which is a program called Workplace Access to SRHR. And UNFPA, probably many of you on the call might not know us, but UNFPA is the United Nations Population Fund. And we really are the United Nations Reproductive Health and Rights Agency. So the mandate of UNFPA can really be summarized with what you're seeing now on the screen and what we call the 3 zeros, because UNFPA works to get to 0 preventable maternal deaths, get to 0 unmet need for family planning, and get to 0 gender-based violence and harmful practices. So the core of the mandate of UNFPA is really around ensuring rights and choices for all and realizing sexual reproductive health and rights everyone. And UNFPA works in over 150 countries worldwide. And in particular, in the Asia Pacific region, we work with 22 countries in Asia and 14 in the Pacific. And you might be thinking now, how do we link the mandate of UNFPA into our program, into business outcomes and business and worker well-being? And I think the key link here is that we saw at UNFPA the opportunity to involve the private sector and businesses to make sure that they can really be agents of change, to ensure that their workers, their employees, and women employees in particular, have the means to realize their sexual reproductive health and rights. And businesses really have the opportunity and the power to provide choices and opportunities to their employee to overcome some of the barriers that workers might face in accessing crucial health services. And this is because we need to think of the demographic, I would say, of the manufacturing workforce in Asia in particular. And if we think about it, in many countries, a lot of women are employed in the manufacturing industries, particularly in the textile and garment industry. And often these women are young and might be migrants because they might have moved to the city to go work in the factory, or they might even have moved from neighboring countries. So we see how the employees might have a real might face a real struggle to access sexual and reproductive health services, especially if they're involved in the factory for during the day and might not get the chance to go to the clinic. So really, we saw at UNFPA the opportunity to partner with businesses to make sure that there was a way to overcome the barriers for employees. And really, this is how the idea of the ROI tool was born. So the ROI tool is what it says there on the title, investing in workers' well-being. When we started the project, even before partnering with GBL in this phase of the project, UNFPA had developed with some partners a very basic prototype version, even more prototype than the prototype that Sushmita showed you earlier. And this earlier version of the ROI tool looked in particular at contraception. So providing contraception to workers to ensure that they could plan their pregnancies and to reduce the number of unintended pregnancies that might happen in the workforce. And the tool started to be utilized in some of our partner countries, in particular in the Philippines. And we saw how it created a lot of interest in the private sector. So we decided to expand on the ROI tool. And in the second phase of the project, which is the one where we got into a partnership with GBL, the ROI tool project, which was supported by the United Nations Foundation in their Universal Access Progress, and also by Merck for Mothers. The second phase of the ROI tool really saw us use qualitative research methods as described by Sushmita to make an expanded version of the ROI tool, to move beyond family planning only and to include all of those interventions that you've seen on our slides. So to make it really as comprehensive as possible in terms of sexual reproductive health interventions. And the key message of the tool is that showing the possibility for businesses to improve their workers' health and well-being means that workers might have better access to sexual reproductive health services, might become healthier in return, and can be more empowered and make better decisions and have more decision-making power in their personal and professional life. So the tool advocates for a more productive and empowered workforce. But at the same time, it can show, and that's what the business outcomes part of the tool is all about, it can show to businesses and private sector companies that investing in workers' health and well-being can have a return on their investment, a return in terms of increased productivity, reduced absenteeism, and reduced staff turnover. So really, it's a win-win for everyone. And we want to show that improving access to services for the workforce also creates economic returns for the businesses. So what's next for ROIT? You've heard Sushmita presented very comprehensively, and I think Rochak has put the link in the chat for you to go and explore yourself on our website. But so the tool has been just recently finalized, and what we really want to use the tool now for is to really strengthen the business case for private sector investments in workers' health and well-being. And I think one of the points mentioned by Sushmita earlier is that when GBL helped us do the systematic literature review, we realized that there wasn't a lot of purely peer-reviewed or academic literature related to this link between health interventions and economic and business returns. So that was definitely a challenge for us in the development of the tool, but it also shows how we really need to move into creating more evidence around the business case for private investments into workers' well-being. So the next phase for ROIT at the moment is to, first of all, partner with companies, for example, like Shahi, who's here on the call with us, to really see if we can use the tool to make the projections first, see what the tool says in terms of the business outcomes, and then implement the interventions as suggested and measure the impact. So it really shows that there will be opportunities for using monitoring and evaluation frameworks or conducting implementation research to validate the projections that the ROI tool makes, and also to continue building the evidence base for this sort of work, because we know that companies are supportive of workers' well-being program, and they are supportive of fulfilling their corporate social responsibility commitments. But they also need to have evidence that this works, and this is a positive win-win for everyone. So that's what's next for us, UNFPA, and we really look forward to continuing this path that we've started with ROIT. This really leads me to the last slide for my presentation is to talk about the importance of evidence generation and research in program development. And of course, speaking from the perspective of a UN agency, we really want to make sure that all of our programming, whether it's in development context, whether it's in humanitarian context and responses, all of our programs need to be evidence-based and need to have sound research at the heart, which makes us sure that what we're doing has a positive impact. And of course, this can be done like we presented today with the ROI tool to the workplace access to SRHR program is one example, but we really want to focus on all aspects. In the case of UNFPA, it's our mandate, it's midwifery, it's maternal health, or it's even financing for sexual reproductive health, making the economic case for investing in these services. So the opportunities for collaborating with research partners like GBL, it's really critical to our our job. And we look forward to having more opportunities to test the ROI tool in particular, but also all of our other programs. So thank you, and we'll look forward to the discussion at the end. Thank you so much.
Thank you so much, Federica. First of all, I would like to thank UNFPA, Federica, GPL team, Rochak, Sushmita to organize this platform. I think it is wonderful. And I'm quite excited that, that now we have an international audience to all the interventions, we have been toiling with for past so many years. And it has been very, very difficult for us to really conceptualize, implement it in such a labor-intensive industry like apparel. So you can imagine Shahi with a complete employee strength of more than 113,000 plus people, working for the organization. How complex this can be to implement the programs, and it has been a mystery all around, what happens after all these interventions. So for us in Shahi also, we could assess a lot of results, but after we partnered with GBL, it was, a great learning curve for Shahi also as a business partner, that these interventions can be evaluated so well. And we can actually see a complete business outcome, which can impact the bottom line of businesses. Just like to, quickly walk you through some key interventions, what we have been implementing at Shahi, and how did we partnered with GBL when we created this return on investment tool, and what all challenges we felt, and how it can really impact the manufacturing setups, and especially the labor-intensive ones. It can be applicable to anywhere. So quickly, I would like to share with you that out of 113,000 employees, more than 70% are women. For all these years, we have been investing in a lot of programs to support better health and well-being initiatives for all of our employees to improve their overall well-being and indirectly their quality of work also as well. When we partnered with GBL, we were, quite supported by the randomized controlled trials, which is a very strong research tool which GBL brought in. We have applied these tools into all our interventions which have social and business impacts. And then we try to do a lot of research. We try to understand how these programs can benefit similar labor-intensive industries and other manufacturing industries as well, and to encourage them to invest in their workers' health and well-being. And we also ensured that these interventions programs, which are supporting the workers' health and their work well-being, are scalable to a very large number of setups also as well. So the first intervention program which I would like to touch upon is the sexual and reproductive health. We did a lot of research in our migrant workers. Then we found, most of these workers and working associates, and more than 70% of who are women, they are actually, I would say, ignorant about various aspects of family planning, safe and supports, reproductive health education. Plus, we also found that there is a huge and numerous taboos around discussing all these topics like family planning in various households and plenty of communities in India. So that is where we started with this program, Sexual and Reproductive Health Program. We then partnered with the Family Planning Association of India, and this is the program we are ready to launch this year. Second program is a very interesting program. We call it an Iron Woman program. The reason is that when we delved into this particular topic, we found out that India has the largest number of anemic women in the world. And more than half of this complete population is these women are of reproductive age and these are anemic. And being anemic is painful. It is not easy. It really impacts a complete agility. There is a problem with the mental health also. It creates pain, and the patients, they are actually in the constant discomfort. And anemia can also result into a lot of serious productivity loss in the manufacturing units, because imagine the women suffering from anemia and they're actually moving and walking with all these ailments. So it impacts our productivity, quality to a very large scale. Then we came out with this program known as Iron Women, in which we tested the blood hemoglobin levels for approximately 20,000 women across our 25 factories, after we partnered with ESI in India. And then we found that 29% of the women were anemic. And then we supplied all these women with free iron supplementation, with the support of ESI. And then now in our rural factories, we are, testing. We have tested again more than 13,000 women in the terms of hemoglobin. So this has been one of the, engaging programs for us, and which has brought in a huge learnings. And then another program I would like to specify is Menstrual Hygiene Management Program. And this also was a very, very huge learning to us when we did our research. How much ignorance is still there across the community in the terms of menstrual hygiene. And it is then we launched this project known as Prava, which is core to women's health. And here we try to educate women over various aspects of menstrual hygiene, its management. And also we installed automated machines, which can be accessed by the workers. And these sanitary napkins are provided at an extremely low cost. And these are very high quality sanitary products. And these vending machines are very easy to operate. And practically all these operators, all the women associates, they can actually access these vending machines. And just to share with you, 1,000 female garment workers were trained upon the menstrual hygiene piece. And since past 2 years, 38,000 sanitary napkins has been used by the women. And believe me, out of this complete strength, earlier, hardly anybody would use a proper high quality sanitary napkin. And earlier they were using all kind of, homemade solutions to manage and to deal with the menstrual related problems. Now we are working upon to take it to the next levels. Now we are actually trying to scale it up to rest of our factories. This also has been a very, very breakthrough product. And after intervention and after the GBL researched, we could see a lot of business benefits, which I would be sharing in a short while. After we were working with GBL, when we are developing these tools, we had to experiment on lots and lots of angles, because apparel as an industry, it's a very complex industry. It's labor intensive. Imagine approximately 5,000-6,000 people working under the same roof, and imagine the kind of data which comes out. And here we are trying to implement a project which is supporting the women on their health, on their well-being. So it becomes very, very difficult to really separate the outcome. We just can't say that, it is coming out of, maybe if there is a productivity hike up, there is an improvement in the productivity. It becomes very difficult how this productivity improvement is coming from. So it is difficult to isolate this impact of an intervention or productivity, because there are many, many factors on a day-to-day basis influencing productivity. The way we operate is we have got assembly lines. So if there is a crisis in the complete manufacturing unit, so plenty of times, workers, they may have to shift from one line to another. And this spoils the complete dynamic of, the complete formula of how do you create an efficiency, because number of people is very, very critical, very important to calculate the, efficiency overall. So this disturbs the complete dynamic. Then we suggested that GBL look at more tangible data points. Like instead of looking at the productivity, efficiency, which is complex, then we suggested that GBL looks at more tangible data, which can be, studied much easier, much easily, like absenteeism, turnover. These are easy to track. And through the worker well-being initiatives and the health improvement initiatives, these aspects can be improved to a very, very large level. Because workers' health is a very, very critical and important element because of which, workers are forced to take a day off. Maybe their health, maybe their children's health, these are very, very important. And imagine if few of the workers, they take a leaves, so the machines on which they are working, they become vacant. And if the machines are vacant, that means we don't produce and we lose business over this. So I have seen plenty of situation in which there is only 80% occupancy in the factory. Imagine 20% people are away, so that means we are not producing in 20% of the machines. So if by the interventions like these, if we can support the health of these workforce, and still we are able to bring in that 10% people, imagine the kind of support we give to the complete manufacturing setup. So these are the angles. For many years, businesses have been quite busy to look at these finer points. And this is business. This is pure money. There's worker well-being, but indirectly, the business organizations, they are creating money, and this impacts the bottom line like anything. It has a great impact over the complete bottom line. Another example I would like to give you is, say, menstrual hygiene management. We have observed in our medical rooms also plenty of women in our workforce. They struggle with a lot of health issues during their menstrual time, and in plenty of women it's a painful process also. And our medical rooms, they are normally occupied with the women undergoing such a stage, and plenty of women are actually embarrassed to maybe even share that what is that they are going through, right? Even talking about topic like menstrual hygiene, it is also a taboo in various communities. So these women, they suffer very, very silently. So when we rendered this kind of a support, this had a huge impact over the complete absenteeism of these women. Plenty of women, they even try to take a half day off, in case they are going through the menstrual periods. In a nutshell, what I'm trying to share with you is aspects like absenteeism and attrition. These are very, very important aspects for our manufacturing setup. If this can be controlled in a labor-intensive factories, it can have a huge return on investment. And this is something which this tool, ROIT, is trying to capture. And the biggest thing is, when we start to give support to the workforce, there is a huge word of mouth to our factories, and plenty of new people who want to join a workforce. They try to come into the industry, they try to join our factories. That is additional benefit which these interventions, with supports of worker well-being, health, this actually bring in. So these labor-intensive industry like apparel, that's somewhere in the middle of being organized and unorganized both. So it is not too organized, it's not too unorganized also. So it is somewhere in the middle. So there can be a lot, and there is a lot to be done for the worker well-being, especially with the female workforce coming from a lower income backgrounds. Until now, businesses has not done enough for interventions, programs, investments for improving the health of the workforce. Operations, manufacturing, they have been spending millions of dollars in improving operations, productivity, machines, technology. But this is a new way to think about it. In case, and this investment is, it is worthwhile. So this is a new way to look at it. We now feel should be a part of the core business strategy, which has a direct impact over the bottom lines of the company and the profitabilities of the companies also. Another example, very interesting example I would like to share with you is, we also have recently started to study the eye health of people, of the workforce. Nobody could ever imagine it. So we started to, get the eyes checked up of female workforce. Imagine one thing nobody thought of. When the workers and the quality checkers who actually check the quality, in case they have a bad eyesight, imagine what kind of a product they can pass, sent to the final stage. So the products, they go to the final stage, and after that they come back for a rework just because of a poor eyesight. And there are plenty of women, they're absolutely ignorant about their eyesight. So when they produce, when they stitch the garments, imagine how big risk the industry runs on that, a low quality product can be produced because of a bad eyesight. So imagine what kind of a business impact these interventions can be, so which has a direct impact over the complete businesses. So this is an amazing beginning, and I think the complete community and the complete manufacturers, labor intensive industries, they must look at this angle. And I think the return on investment tool will also validate the viability of investing into these interventions. Correct. And I think United Nations Population Fund, I think it's a great initiative they have taken so as to empower the industries all across and help them out to really invest in these interventions and evaluate the overall impact also. I think this is a good beginning.
Then maybe we can move on to the questions that we've received from the audience. So the first question that we've received is, were these programs CSR funded or business costs? So maybe Sushmita and Federica, you can answer that. Sushmita, you can go first.
Yeah, hi everyone. Thanks, that's a great question. So speaking for this particular project and the ROI tool, it was funded by UNFPA, and here I think as research organizations, especially nonprofits, we're quite reliant on organizations that fund us. So in this case, UNFPA was our funding partner, and they were the ones who in fact came to us with the requirement, and we were really fortunate to have the opportunity to work on this. But yeah, GBL partners with various different organizations, and we also get some of the funding through grants. And yeah, so we're really dependent on this kind of external funding in order to be able to continue our research and then pay that forward. Yeah. And I think Federica can expand on that.
Thank you, Sushmita. Thank you for the question. Yes, as mentioned, we are the Workplace Access to SRHR program was funded in the broader context of of donor-funded projects for UNFPA. And I think that, thank you, Sonvi. I see your question in the chat. You meant the implementation of the projects, right? So the ROI tool itself is a projection tool. So it's meant to estimate what would be the costs required for the implementation of the interventions. And concerning your question on who pays for Shahi's implementation of health projects, I will defer to Mr. Deepak, but I just want to share here how the ROI tool allows businesses to project the cost. What would it cost to implement this intervention? And in the cost section of the projections, we have inputted some default cost based on our research. For example, how much does it cost to buy iron folic acid tablets or sanitary napkins and so on. All of those costs can be customized. So if your organization or a company has information on the local costs, for example, the local market cost of the products or the medicines and so on, or even of the trainers for the interventions that require training, all of the costs in the tool can be updated from the default values provided. So to really give a sense of the real projected expenses in the local context where the projection is being made. But I'll pass it over to Mr. Deepak for Shahi's.
You see the complete cost. When we started these interventions, this journey technically started around 10 years ago. By and large, these have been self-funded projects till date. You know, we have been funding from the Shahi's and Shahi's kitty from our own profits. And fortunately, our management started to observe benefit from these interventions. You know, because you know, absenteeism and attrition is a big problem in the labor-intensive organization. While you are doing, GBL is doing research now, we are actually able to delve into a very finer points, very deeper points, you know. But before these researches, we could see, the business could see benefit in the attrition control, you know, people were not leaving as much. The management observed that people, the absenteeism, it improved. There is another aspect which is never talked about, that is unauthorized absenteeism. It is a bigger curse than a absenteeism. You know, imagine we have got 1,000 machines lying and we are planning a new style in a particular production line. And 5 key important workers, you know, operators, they have taken leave without informing. It happens because they are not to be blamed also plenty of times, because their life is also not that easy, you know, because of transport, because of kids, plenty of times, you know, they take unauthorized leaves. So this is a bigger problem than the leaves actually. So when we started to invest in these programs, especially trainings, attitudinal trainings, you know, then the business started to see some respite from all these factors. So they started to fund it. But now, when we are actually launching the programs like Iron Women, in which you know, we are helping our women workforce with the iron supplements. So there are government schemes in which we are taking its support, we are taking the benefit of these government bodies like ESI, who is helping us with the iron supplement tablets and other components. We are also looking in for some, we have not done it, but we may look in for the CSR funding, you know, which can support the women workforce also. Till now, predominantly it has been self-funded, but we are exploring into, you know, take support from outside also as well.
Thank you, Mr. Deepak. I think we can move on to the second question. This is for you, Sushmita. How much involvement does the tool need from GBL? What kind of scale, simultaneous number of companies can this tool support?
Yeah, so here I'd like to say that while GBL was involved in the design and development of the tool, it's now a product of UNFPA. So it's really where they take it from here, but we'll definitely be involved in seeing where that goes. And I think Federica can speak better to the technical aspects of how many businesses it can support. But being a freely available online tool, it was designed to not be very heavy and like it loads easily and all that. You can try it out for yourself. Yeah, so over to you, Federica.
Thank you, Sushmita. Yes, so the tool is hosted on UNFPA's website, so it's free to access for everyone. You can go onto the link, have a read at the programs and the way it works and how it is being created, and you can essentially create a profile and start trialing out projections. So there shouldn't be any need for support, because we have a ROI Tool guide and videos there created to show you how to do the projections, which you saw a little bit at the beginning of this webinar. So it should be really intuitive and self-explanatory. And of course, there are some contact details in the tool if you have questions, and you can contact UNFPA and ask us any question for support. But as Sushmita said, GBL has really been our research arm for this. We couldn't have done it without them, and the time that the team spent in the research phase before, and then in the design and creating the tool itself. But it's freely available on our website, and you're all very welcome to trial out projections. And the projections, you can make as many as you want. You can make projections for all of your employees, or you can target them. For example, you can do a specific factory, or you can trial out one intervention first in one factory and then see how it goes from there. Thank you.
Thank you, Federica and Sushmita. I think the next question is also for you, Federica. How do you see the potential of such tools to support rights-based frameworks for workers' health and workplace rights?
Thank you so much. Excellent question. And I think really this was the core of what the ROI tool wanted to support. There are interventions in the ROI tool, which are not just service provision, for example, like iron folic acid or sanitary pads, but there are also interventions related to training and peer-to-peer training. And there's one specifically on sexual reproductive health and rights. So the idea is that by providing workers with the opportunities to learn, and also Mr. Deepak really explained, right, in his examples from Shahi's factories, it should create an environment where workers can become more empowered, and by implementing the interventions in the factory, also get to explore more about their sexual reproductive health and rights, but also beyond. It's also life skills training and knowing, for example, some basic economic management, money management, financial skills, all of that. So we really hope that by showing the returns on investment for implementing the interventions, the tool can become a conveyor of the importance to invest in workers' rights and workers' well-being. So that's the framework for which the tool was designed and created. Thank you.
Amazing, thank you. I think the next question is also to you. What is the plan to scale the tool with other corporate houses? Are there more examples of corporate being sensitized and adopting the approach and the tool? And maybe there's one more aspect I would like to add to this. Are there any particular sectors which you see this tool being used as much? Because we tested this with Shahi, which is like a big apparel manufacturer in the garment space, right? So do you see any other sectors also being involved while scaling up this tool?
Thank you so much. So the tool, we've started to use it and orient business partners in Bangladesh, through our UNFPA country office colleagues as well in Bangladesh. And we've presented the tool, and we've shown how it works to the Bangladeshi manufacturer associations. There are many, of course, as you know. There's the BKMA or the Garments Association, the Leather Association, footwear, and also to the brands, because that's also a part of our engagement related to the ROI tool, is also to show the corporations and the brands like H&M and Primark and Uniqlo, how they can also be promoting the use of the tools in their partner factories and in the companies that they use to create the garments. So Bangladesh at the moment is our first country where we're starting to pilot some of the interventions, but also the previous version of the tool, and hopefully now also this expanded one, was used in the Philippines a lot. Our actually original program was in the Philippines, and partners who have used the tool there really saw the impact in terms of increased productivity and returns. And it's also interesting because in the Philippines, and it's related to your question, Rochak, we use the tool also in industries that are not related to garment or apparel. For example, we had industries in the tinning industry for fishing, canning, so doing the tuna cans and the fish cans and all of that. But in the Philippines as well, there's quite a sizable female workforce in the manufacturing sector. So of course that was a very good entry point for UNFPA. But experience from our colleagues in the Philippines also shown that actually the male workers benefit a lot from the program. So in the tool, there are some interventions, of course, that are strictly related to women, for example, menstruation intervention and iron folic acid. But all of the factory, clinic, the subsidized SRHR products, the training, it can also be, of course, provided to male employees. And in the Philippines, we have testimonials from male employees of the factories where they said, I really learned how to better plan my family with my wife, for example. So it shows that there are very broader opportunities to involve the whole workforce and not just the female employees. But having said this, we're excited because the tool has just been finalized, really. So we're at the early stages of getting to know our partners and market the tool around. So we're looking forward to potential opportunities to collaborate and use this in other sectors and in other countries as well. Thank you.
From a business point of view, what are some gaps in the domain of workers' health that can be filled by research organizations?
Research organizations can partner with a lot of industry, a lot of business points across industries. It is, when there are strong evidences now what we are creating in terms of the benefits and the business benefits which the industries and organizations can enjoy by investing in certain aspects. For example, hygiene is one of the big aspects where the research organizations can partner with the organizations. If something can be done in terms of the hygiene across the manufacturing, believe me, it can have a great impact over a lot of absenteeism, because hygiene is one big factor because of which the workforce, they fell sick, they are not able to come to work, and it impacts the profitability directly. Some of the factors like eyesight, as I shared with you, is a big component. The ignorance of the female workforce, in terms of these important elements like eyesight, this also is a big area for the research organizations to partner with. The biggest opportunity which I see, mental health. This is something which less people are talking about. Mental health is a big area where the research organization has a huge opportunity to partner with the industries. Because of mental health, if this can be supported with the help of the research organizations, and if you can weave interventions around the mental health for, of female workforce, especially, because, if you see closely, they have got a tough life, basically, all across. They have families to feed, they have kids, they travel all across, then they work for 8.5 hours. So it's a complete challenge. So if there are interventions over the mental health and the research organizations can partner with the industries so as to, show it that how beneficial it is, I think a lot can be done in the domain of mental health. It would directly help the female workforce in terms of their physical well-being also. All right, so they can be motivated to take up better practices, better health practices, be calm, be happy. So imagine if you can do something about the happiness in the terms of this women workforce. I can guarantee they can turn on the complete production of any manufacturing unit. So it is just a matter of looking at these areas like mental health as a great opportunity, and for the research organizations to partner up with these manufacturing organizations to show the benefit. I think these are big and creative business strategies. They cannot be ignored by the industries, because industries like apparels, constructions, labor intensive, pharmaceuticals, labor intensive, they have done everything under the sun today to improve their productivity. Believe me, apparels, textiles have done everything to improve their productivity. And still now we are not understanding where to go. But these are new areas to go, which can have a direct impact. We work with women workforce, we work with people, and we work with machines. So unless and until we don't invest in these people, I think this is a sure shot strategy for the businesses. So these are a couple of areas which I feel research organizations, they have a huge scope to partner up with the industry, which can actually boost up the complete, and dynamics of these labor-intensive industries.
Absolutely, great points. So yeah, that's I think all the questions we have for today. Thank you everyone for joining in. Do contact us if you want to partner with us. If you want to learn more about our work, there's the info@Good Business Lab ID there, so you can drop a mail there and we'll reach out to you. And thank you so much for joining in. Thank you everyone. Take care and have a great evening.
Thank you so much for the great questions.
Thanks everyone.
Bye.
Thank you.
Bye.
Bye.
Thanks, Federica.